And we're live. Greetings, guys, gals, and non-binary pals. I'm Joe Foljam. Joining me, as usual, is Dr. Rob Tarzwell. Torrin Atkinson is stuck in a car right now. I think he's going to try to make it in. Our guest tonight is Dr. Greg Rose, who's returning for his second visit with us. And as usual, I will note here that viral transmission is supported in part by the BC Humanist Association. You can learn more about them at bchumanist.ca. I'll add again, as I do every time, they're good people. We're really happy to be supported by them. So, Rob, we're doing Maskpocalypse tonight. That's the big story, I think.
On us. That's right. So there's a lot. We're going to talk about masks tonight. Big focus on masks and some of the disinformation floating out there about masks. And one of them that we can actually empirically test is, do masks cause reduced oxygen, or what we could call hypoxia? And what I have here, this is a device called an oxygen saturation tester. And what it tests is your percentage of oxygen saturated hemoglobin, because hemoglobin is the molecule in your red blood cells that carries oxygen. And you have two kinds. You have oxygenated and deoxygenated, because once it gets rid of its oxygen at the cells and then comes back, that's deoxygenated. And because these have slightly different properties, we can measure their ability to block red light and infrared light. Oxygenated hemoglobin prefers one frequency. If one frequency is blocked, another one passes through. Deoxygenated hemoglobin, it absorbs the other frequency and lets the first frequency pass through. So it's, you just figure out the percentage of transmission, then run a simple calculation, and it tells you what percentage of your blood is saturated. And this is the number one tool we use to determine whether a patient is hypoxic or not.
Okay.
So you can get this in London Drugs. So I'm going to turn this on here. This is my baseline oxygen saturation. That's that big 97.
97.
That's the percent. So 98% right now. This is pretty typical. We're near sea level. I'm probably like literally, 7 stories above sea level, because False Creek is across the street. And that other number that's moving up and down, the smaller number, that's my pulse. We can ignore that. But can everyone see that nice 98 there?
Yep. Yeah,
so,
98.
Yeah, and that's a very typical. Anything above 92 is considered normal for clinical purposes. So I'm within a normal range here. So what I'm going to do is I'm going to put a mask on, and then every few minutes I'm going to measure my saturation, and then I'm going to put on another mask and measure my saturation after a few minutes. And then I'm going to put on another mask and measure my saturation. And we will see what happens to my blood oxygen levels while we're talking about masks, mask evidence, and all the latest coronavirus developments with our infectious prevention and control specialist, Dr. Greg Rose. So now we've got a 98 here, pretty well established. So I'm going to put on a mask, and we'll measure that again in a few minutes, but of course I'm going to, use proper hand hygiene before putting that mask on. This is an alcohol sanitizer, and this is something you should be doing before you put on a mask, and especially after you take off a mask or adjust a mask. If you touch, ideally we don't want you to touch your mask when you're out there checking out the radishes at Safeway, but sometimes you just unconsciously scratch your nose. If you think of it, don't get hard on yourself. Just pull out the alcohol cleanser, and then you can fondle the cucumbers.
Yeah, when you have to adjust out the what I heard was try to adjust it by the straps that you've got on the side.
Yep,
You can touch
exactly.
these.
And then here we go, and the nose piece is on. All right, so this mask was made by my good friend Sarah Dewick, who has taken up the cause of just making cloth masks and distributing to the downtown east side. This is a Star Trek themed mask, which she made by special request for me. And let's see what this does to my blood oxygen. So Greg, welcome back to the show. Good to have you back.
Good to be back.
Yeah, I mean, this unfortunately, there's lots of news in the world of coronavirus, and our big theme tonight is masks. But of course, there's also a lot going on in the U.S. with the big recrossing of the 30,000 cases per day threshold just passed today, I believe. So, but fortunately, so far, no parallel spike in fatalities, but that might just be lagging by a few days. Perhaps you could kind of tell us a bit about that. So why don't you kind of give us the global update as you understand it, and then let's just go from there right into masks, the good, the bad, and the ugly.
Yes, our American cousins have been uniquely hard hit, I think, in going into something of a second wave before they ever really exited their first wave. If you look at the data from the United States, especially I like to look at it in visual form, and we look at the number of cases per day, they rose up to a peak in early April. They came down to their lowest level in late May, and then they've been rising back up again. And we haven't really seen that to that degree in any other jurisdiction, and it's actually quite curious. Many of the hardest hit countries prior to the United States, Italy quite famously, Spain, Germany, France, they got over their first wave, they got their numbers down very, very low, and they've had occasional blips, but nothing quite so sustained as what's happened in the United States. And to be honest with you, I think the idea of the masks plays into it. You still have a great degree of compliance with social distancing measures in many of the countries that have been very hard hit. Indeed, the more strict the restrictions on travel and socialization, the more successful they control. The United States, of course, is a country built on individual freedoms as a foundational tenet, and I think this has actually played into the response of the American public to things like staying at home, wearing masks in public. And you get a lot of pushback against the idea that wearing a mask is potentially beneficial. So it's important to talk about why it's beneficial. I think one of the things we run into here, and one of the reasons why people might be reluctant to wear masks, is the infection control and public health folks of particularly North America, have done a very bad job in talking about masks over the last several months. And people will rightly point out that the messaging has changed very dramatically. In the Canadian context alone, in February, we were saying at a federal level, you shouldn't be wearing masks in public. In March, we were saying, well, you can wear them if you want to. In April, it was, well, maybe it's helpful. And then in May and June, it's, you probably should be wearing a mask in public. And we haven't gotten to the point, of course, where it's mandatory at the legal level, although some businesses have made it mandatory to enter their premises. And I think what you're seeing there is a very honest response to competing pressures. In February, we were very, very worried that we were going to run out of supplies. We're actually still kind of worried about running out of supplies, to be honest with you. But in February, the concern was if we say you should be wearing a mask in public, people were going to be buying up, grabbing, stealing, which unfortunately stealing of other supplies was happening, including gloves and hand hygiene, alcohol gel. Yeah. We were worried that we were going to lose procedure masks, the medically regulated masks that we would wear for doing surgery, for example, or doing minor procedures in hospital, otherwise called a rated mask. And we focused a lot on that. And there's a lot of reasons why masking is not a panacea. It's not necessarily going to be the thing that fixes the spread of COVID. We were concentrating on the reasons not to do it in February because we were trying to get people not to panic buy masks the way they were panic buying toilet paper. Happily, as your friend has demonstrated with that very stylish mask, creating cloth masks is actually something that can be done and can actually spur the creation of PPE, what's the term I'm looking for, inventory here in Canada. Creating masks is a relatively simple thing to do. A skilled seamstress or tailor can do that relatively easily, and they can be beneficial. It's been mentioned, I think, in a number of sources that we've had new data over the last few months about the efficacy of masks in control of COVID-19. And I would say we probably don't have a lot of absolutely spanking brand new data. Most of the studies that look at how well cloth masks work are actually, at least a few years old, and they would be used in the context of things like influenza and even the SARS virus. But we do know that masks accomplish two different things to one degree or another. One is what we would call inward protection. So I wear a mask to protect my nose and my mouth from contracting whatever the infection is I'm trying to avoid, so protecting me. Mm-hmm. And we know in a situation like that a cloth mask is not as effective as a rated surgical mask. So those are the rectangular ones that you see at the hospital with the wire piece, and probably even less so, not as effective as the N95 respirator, which is a much more dense filtration mask. But in addition to inward protection, masks also serve as outward protection. So keeping my respiratory particles, my droplets, from spreading out from my mouth. And that's really where we've been trying to focus the messaging since at least the start of April, is that wearing a mask will keep your secretions in and from spreading to other people. Cough catchers, you can call them as well. And the data on those date back actually over 100 years, because of course we've been using cloth masks, or we're using cloth masks in the surgical context since the early 20th century in an effort to keep surgeons' respiratory droplets from inside the otherwise sterile parts of the body that they would be operating on. A lot of the data that support the use of...
I can only imagine the fights that the surgeons put up over wearing masks. Oh, Ed, hey, it's been a few minutes. It's time.
Yeah.
The time to measure. Okay, the number's going to pop up. Here it comes. What is my oxygen
So
saturation?
sorry that you're doing this to yourself, Rob.
What's that?
I'm so sorry you're doing this to yourself, all this damage you're doing to your body by wearing this mask.
Wow. Yeah.
97.
97. I think it was a 90. Oh, there's 98 again.
98.
Okay, never mind. Don't call the ambulance. Yeah.
I know.
All right. Hold on. I'm pretty sure that we can make this happen, right? We can actually demonstrate a medical effect here. So I'm gonna have to put on mask number 2 first.
So this is a rated procedure mask.
Yeah, I wanted to mix cloth masks with rated masks. Oh, let's get that back up there over the nose, and yeah, so let's get this procedure mask here, get the wire bent so you can't say I'm cheating by letting the air escape. Let's pull that down. All right. So carry on, Greg.
Now I have to say, if I were to see you wearing that in my hospital, I would ask you to have one mask on at a time. There is no greater benefit to the mask sandwich, as it's sometimes called, and we've definitely seen people doing that. Especially when there was quite a lot of concern over what was a poorly understood mechanism of transmission. We saw quite a lot of healthcare workers who would have the mask sandwich on with some combination of an N95, a cloth mask, and a rated procedure mask. Not necessary for the most part. However, for the purpose of demonstrating the safety, that's why you're doing it.
Yeah, that's right. This is not something that you should try at home, kids. I'm a qualified professional, and I'm willing to risk my life for you to prove to you that, that I'm just an attention-seeking jerk.
Now, Marilee is there in case you go unconscious, right?
She is there, yeah. But if I go unconscious, then everything I understand about physiology
I know.
is desperately wrong, and I need to just resign my medical license if that happens.
I know. Yeah. It's really sad that we're going to find that out this way with you going unconscious. Hey, Torrance here.
Hi.
Welcome to the
How's
show.
the experiment going?
Well, I've just put on my second mask. My oxygen saturation is 98% without a mask. It's between 97 and 98% with one mask, and so I just put on mask number 2. Normal is anything above 92. So let's see what happens.
double the mask. Wow. Okay.
We're not done yet, baby.
Okay.
Yeah.
We got more to come.
Oh,
Now,
yeah,
of course,
yeah.
there can be adverse effects from...
Where did you put?
There can be adverse effects from wearing masks, or actually, more appropriately, really from wearing the N95 respirator. And this was part of the messaging that was being pushed in February and March as well. Wearing an N95 respirator, a fitted N95 respirator for prolonged periods of time, we're talking 6 to 8 hours, the way people were doing when they were working during the SARS mini pandemic, can be associated with 2 things. One is it can cause actually irritation of the skin around the seal of the N95, and there are a variety of ways that health professionals deal with that. There are a number of products that can actually protect the skin and can help to recuperate from what is the technical term is irritant dermatitis, or basically irritation of the skin leading to a rash. The other thing, though, is you're measuring your oxygen from what you're inhaling, but there's also, of course, the carbon dioxide which you're exhaling. And prolonged wearing of an N95 respirator, not the masks you have on, but an N95 respirator, can actually cause some rise in carbon dioxide, not to dangerous levels, but enough to give people kind of a feeling of being a bit tired and a bit cranky. And that's usually after several hours of wearing it, again, as we were having to do back in 2003. Otherwise, masks are pretty darn safe. Feeling okay?
Yeah. This is a very mundane experiment so far.
Yeah.
Disappointingly mundane. We'll wait a couple more minutes and then I'll check my saturation. Maybe some good things are happening with the numbers.
I feel like if you put a few more masks on, we're not going to be able to hear you and understand any of the words you're saying.
So there are other benefits as well, obviously.
Oh, snap! Oh, I think we just found our new co-host. Tarzwell, you're out.
It's all right.
All right.
Tarzwell will be out unconscious soon because he's wearing all these masks. We'll have to replace him.
It's time to measure some oxygen. Here we go. Dun, 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 dun.
With 2 masks.
Dun, dun, dun.
How
2
close
masks.
to unconsciousness will Dr.
Oh.
Rob be? Still a 98.
Bloody hell! It hasn't changed at all. My
Are
oxygen
you
saturation
trying to tell
hasn't
me,
changed at
Rob,
all.
that random dopes on the internet know less about masks and oxygen and health than a doctor does? This doesn't make sense to me.
Well, let's
Hey,
find
who you
out. I
calling
mean,
random?
let's find out. It just maybe I just haven't got enough of a dose yet.
That's
My
right.
mask dose is too low.
We have to
for a
overdose on
physiological
masks.
effect. You've got to overdose on masks. So let's see what happens here.
You've gone
This
too
is-
far. You're crazy. This is insane.
This
Mask
reminds
number
me.
3.
This reminds me of caustic soda. When I can't remember what episode it was, but we were talking about people being suffocated by a pillow, which you would see a lot in movies where they'd shove a pillow into people's faces to suffocate them. And I was like, you can't. I've had people shove a pillow in my face. You just calm down and breathe. You're fine. And I'm pretty sure somebody did it, like actually tried to suffocate me with a pillow. And I just went, just breathe through the pillow just fine. And a pillow is like what? 100 masks? I'm sure you'll be okay.
But were they trying to kill you?
I think it was Kevin, so yes.
Good.
First response episode of Caustic Soda was alcohol, which you also may only have fragmentary memories of.
I don't remember the second half of that episode.
And it's too bad we lost the outtakes because that shit was gold. We could have sold those DVDs.
Lost.
Yeah.
This is not the topic we're talking about now, but if you ever want to find a reason to quit drinking, record yourself getting really, really drunk, and you'll just be like, oh, I don't want to be that guy anymore. Now I'm not going to get drunk anymore. It's been, 7 years now? Worked for me.
Wow. That's a while.
Yeah.
That's a while. 2013. I thought it was really fun just giving you guys tasks from the Montreal Cognitive Assessment. That was my favorite part of the show.
I've actually thought the only reason I would get drunk again is to kind of do another episode like that, like only for the. But I would have to it would have to pay me for the recovery time, because
Now that there's video, I could add things like, okay, Joe, I want you to kind of copy these 2 pentangles. Okay, now Joe, draw me a clock, and
Sorry.
yeah. Then the really good stuff happens.
And because it's cool on YouTube, I would react to something while drunk, because that's also a thing.
And then we have you sober reacting to yourself drunk.
Yeah, which is just
Oh yeah.
Turtle reactions all the way down.
just reactions all the way down. That's what the internet's going to become. Yeah.
So
I think it already has.
yeah,
That's all YouTube's been recommending me lately is reaction videos.
reaction videos.
Here's somebody you don't know reacting to something that you like. You will enjoy this, and they're not wrong. It's terrible.
The algorithm is it's viciously good.
It's been discovering stuff I honestly, when I say it that way, here's somebody you don't know reacting to something you like, you will enjoy it. I think that's a human trait. That's why I want to show all the TV shows I like to you have to watch the show I like, right? But now people are like, you don't know me, but I will watch the thing that you like so that I get that now. I'm sorry, we had a little segue there. Let's get back to you suffocating from masks.
I mean, I think I'm doing okay here so far.
Yeah.
There's a lot of masks on this desk, so we're gonna make
Okay.
something happen here.
Okay.
But back to the masking, and you were saying that there's actually been some, I guess, to use a technical term, some piss poor messaging that has led to
Mhm.
significant confusion, and I guess, well, I don't have to guess. This we see very delayed uptake on mask use by the general public.
Yeah.
So, can you kind of riff on that? And how much
Oh,
of a difference do you think masks make in terms of getting the R0 from a pandemic down to an end and below an endemic level, down below a one?
sure. Yeah, I mean, as a general comment, I would say there's been two pandemics over the last 4 months. One of them is the virus itself, and the other one has been a wave of missing information, misinformation, disinformation, and honest disagreement over information, which has been problematic, I think, for many, many people because we don't often present science to people as something that is a matter of discussion and comprehension and practical application of. But really, medicine, in a lot of respects, is an applied science. We're taking basic science techniques and we're trying to make them practical for people. And there's a lot of discussion that goes into that. So, the pros and cons of wearing a mask. On the one hand, you're going to reduce the amount of virus and other potentially infectious organisms being spread into the environment. You're protecting your mucosa. That's a benefit, but the drawbacks are it could irritate your skin. It's hot on a hot day. Could be using the supply up, which is certainly our major concern in February. So balancing out these competing priorities is part of what we're supposed to be doing. And it creates sometimes shades of gray that the public really is not comfortable with, particularly when people take those shades of gray and they then take them to the extremes, or they in any other way kind of binomialize them into I'm completely right and you're completely wrong, which is unfortunately one of the major trends of information in the internet era. So, I've got colleagues who've been saying since January we must all be masking all the time, and they feel that they are quite vindicated now that that is actually the message: is the public should be masking when they're interacting. And I've got people who basically feel that we've gone the wrong direction in recommending masks. It's interesting. I'm based in Ontario. The Public Health Agency of Ontario, PHO, actually still has a statement about the evidence behind mask wearing, essentially along the lines that there is no large randomized controlled trials that really support the use of masks. Now, randomized controlled trials are the top level of evidence in medicine, and they're right. In fact, I've just recently submitted a systematic review of randomized controlled trials of cloth masks, and there really isn't a whole lot out there. There's really one, and it's not.
Oh, so it's a short review.
Well, we threw in a couple of other things as well.
Okay, all right,
You have to flesh it out a little. I mean,
sure.
but there are other types of data. You just have to be a little bit more careful how you use them.
Right.
It's true though. However, I always in these situations I like to think of an absolutely beautiful, one of the best papers in all of medicine on any subject was a systematic review that was published in the December 2003 edition of the British Medical Journal, and Rob may already know the one I'm talking about. It was a systematic review looking for randomized controlled trials of the use of parachutes to avoid major trauma when jumping from airplanes. And as it turns out, there is not a single RCT demonstrating that parachutes are beneficial when you're jumping from high altitude.
Well,
Nonetheless, we use them. So while RCTs definitely have a very, very well-valued place in medicine, not everything we do is informed by them. As I had mentioned a little bit earlier, we've been using cloth masks in a surgical context for over 100 years. I believe actually Baron Lister introduced that in the 1880s in Scotland. We're using cloth masks in the context of the Spanish flu pandemic 100 years ago. This is not a new thing.
except for the anti-mask league.
This is not a new thing. The government is trying to control me and trying to make me wear this uncomfortable mask.
Yeah,
You know,
a phenomenon called mask madness. And there was a delightful account in a newspaper of a young woman who went into hysterics at getting off the train and seeing people on the platform in masks. And medical men were absolutely convinced that the cause of her nervous disorder was the sight of all these masks.
Oh, no.
So they were very worried about the psychiatric effect of masks a century ago.
Well, and actually, I mean, you would know this better than I would, as you are a psychiatrist. But there are those downsides as well to mask use. There are certain segments of either the medical population or the non-medical population where a mask could potentially be an issue. If you're trying to develop a one-on-one rapport with a patient, and they have some form of a delusional disorder, or perhaps they've got Alzheimer's or some other dementing disorder, wearing a mask on your face potentially could actually cause them to react poorly, as it is somewhat dehumanizing not being able to see a portion of the face. This is a major concern for teachers as they go back to school. If they have to wear opaque masks that cover their mouths, there are probably children that are going to react to that in a stressed fashion and probably not going to interact as well. So in fact, one of the big discussions as people gear up to hopefully having something like a normal school year starting in September is what teachers perhaps should be wearing rather than a face mask would be a clear face visor. And there's a lot of advantages to that too.
Or there's an industry out there for getting a print of the bottom of your face on your mask. The mouth would move.
Which is it'd be very it's very uncanny valley.
That's a little
It's pretty creepy. I've seen the pictures.
That's number 3 on. Spent several minutes.
Rob, you are really muffled now.
Measure my oxygen saturation.
98. So sound can barely get through, but oxygen can just fine. Well, it's like I say,
small molecule that's freely diffusible across permeable membrane.
Well,
it's almost like that.
When you inhale and you take a lung full of oxygen, where do they think that is coming? Like, do they think that you are only breathing in what is inside? Like, that this is becoming a balloon, you breathe out, and there's a lung full of carbon dioxide, and then you breathe it in again. It's not true. It all eventually leaks out, and then you breathe it in again. You're still... The only difference is that pull that you have to do might be slightly harder to fill your lungs. You're still filling your lungs with air from around you. That's why this seems so ridiculous to me that people make these claims. Like your mask isn't a fishbowl astronaut helmet. You're not who's the freaking Toy Story character.
Here comes mask number 4. I'm quite proud of this mask. This is a mask made by Mary, my darling spouse, and
it looks like a rainbow of, I don't know, cereal or Skittles or something.
Is that tie-dyed?
It is not tie-dyed.
Kind of, okay.
It is, once I get it tied on, I'll be able to hold...
Oh, well, knowing Merrily, is it My Little Ponies? It is My Little Ponies.
Oh, right.
Yeah, okay.
Here we go.
It would be either that or Pokemons.
Yeah, she's much more a My Little Pony person, though. Okay, I get it. Yeah, now, when it was further away, your camera just made it look like blotches of color. But yeah, it's totally...
So we got 4 masks on, and like these last 2 are masks that tie, right? So I don't have like the little cheat flaps here. I've got the nose pieces crimped down, right? So there's no escaping this. This is we're deep into Houdini territory here.
Nice.
Can it penetrate these 4 layers of mask, including a medical procedure mask?
Well,
no, you're doomed.
We're mixing it all in.
My guess, based on that, you need you need air of some type in order to make those vocal sounds that you're producing. Is yes, you'll be fine.
Yeah. I mean, in theory, I suppose I could put on enough masks and actually obstruct my airway. But at that point, that's not really a mask issue per se anymore.
Yeah. Even then, like all you'd need is like a straw stuck here to get in enough airway to.
Yeah, but then I'm defeating the mask.
That's
so,
true.
the demonstration here is, can I get my oxygen saturation below 98 for the love of God? Can I get it below 98%?
Yeah.
And how many masks will it take before you can't physically get them around your head or over your ears?
I think we're going to need to keep this experiment going until you pass out. Like, do we have 100 masks?
That's right.
Like, can we have this much mask on your face?
We've got material here.
Okay.
It
is more mask than man at this point.
More mask than... that was a sinister laugh.
This is like how many licks it gets to the center of the Tootsie Pop, except it's like how many masks does it take for Rob to pass out, and I'm way more invested in this than the Tootsie Pop thing.
Okay, cool.
Pass out. We're going to be here all night, though, aren't we?
Well, it's good to feel supported, isn't it, Rob?
It is, yeah. Well, it's sort of like, this is my really ultra benign middle-aged version of Jackass.
Yes.
I could see Bam Margera or Johnny Knoxville doing that with, garbage bags rather than masks.
Oh my God, yeah, of course.
This plastic bag won't stop.
I'm Johnny Knoxville. Welcome to Jackass. This is Asphyxia.
Yeah, except they would just do it. Have they asphyxiated themselves? They probably have. They've probably knocked themselves out.
Well, they've done things involving helmets and excrement. So, they've definitely trended in that direction.
Yeah.
Oh, the shows of our young adulthood. Where are they now?
There's still I saw Steve-O on Hot Ones. Again, speaking of YouTube. It was...
What's Hot Ones? Is that where you drink spicy peppers or something?
You're pretty close. Hot Ones, it's an interview show where while you're being interviewed, you eat progressively more hotter, spicier hot wings. And they do have a vegan option as well. And the host eats them along with you. At the end, it's like nuclear insanity with rage sauce or something. Like it's great because you get to watch people who are famous and living decent lives being interviewed, but being punished while it happens. So it feels really good to watch them have to put up with that in order to get their, exposure boost to their already good careers. I love it. It's Hot Ones on YouTube.
Does Steve-O still have a tattoo of Steve-O on his chest? Yeah. His stories were he just had more dumbass stories about the dumb shit he's done. I can't even remember what they talked about on Hot Wings, but yeah, it was more. I remember watching the episode and going, "This guy is almost 50 now. I think. What is he doing?" Yeah. What is he? So, Greg, just to kind of come back to, the thing that we usually talk about on the show, which is the coronavirus. You said you might have some comments for us on current trends in model. Would you please regale us?
I find it really interesting because, I'd mentioned in the States, they never really exited their first wave before their second wave seemed to be upon them. And we haven't really been running into that to the same degree in Canada. There have been little spikes after Quebec opened up its schools. It had a little spike in transmission amongst their students, and that's with actually a fairly limited. It was only the French language schools, and even then, only about 50% of the students actually enrolled. So certainly, any time you open up society, you're going to risk that kind of thing. We saw in Ontario a little spike about 2 weeks after Mother's Day weekend because a lot of people would go visiting in an unprotected fashion. And actually, that remains, good as masks are, avoiding people remains the most effective way of avoiding COVID. So
physical distancing.
Physical distancing.
Dream come true.
Yes, as a person who loathes highway traffic, I actually there were times in March I was thinking to myself, "Geez, this isn't half bad." But we in my neck of the woods in Ottawa, we really haven't had much of a second wave at all. We had a very big early community wave, and then we had a long-term care facility wave in late April, and both of those were dying down by late May. We've been single digits now for the better part of actually almost 4 weeks in Ottawa now. And people have been asking me, why is that? I think at least one of the major reasons is there's basically two industries here, government and IT, both of which have very well developed work from home policies. So we're really not getting that kind of 40 hours a week in people's faces kind of thing. People have been pointing out to me, if you look at the public spaces, people are gathering. They're at the beaches. They're at the parks, and they're not really physically distancing the way they should be, and that's true. But none of these things is a black and white. If you are within 6 feet of somebody, you're definitely going to get COVID. Each interaction, person to person, is a roll of the dice. And the more interactions and the more time you spend in the presence of a person who potentially has COVID, the more often you're rolling the dice and the more likely you are to have transmission. So anything that cuts that down, anything that reduces those probabilities, even if it's not 100%, it's going to be helpful. And this is, again, why the masks are so useful. A cloth mask is not 100% for outward protection or inward protection. However, for outward protection, it's probably in the 80s. In terms of reduction of spread for outward protection, it's probably in the 90s in terms of avoiding spreading your own respiratory secretions. And for inward protection, it's probably in the 80s. And that really does make a difference. So as we look to reopening society, doing it in a fashion where we're going to be wearing masks, and we're still going to be trying to keep our 6-foot distance, and we're going to be doing hand hygiene. All of these things, even if they're imperfectly done more often than not, they're going to reduce that likelihood of spread. And I think we are seeing the benefits of that in Canada in a way that has not been seen in the States. And again, I think there's a difference between moving towards greater social freedom and completely abandoning social distancing and control measures.
So America, like Sweden, is kind of holding itself forward as a control population for the. Here's what happens if you just act as if it doesn't exist, or at least if large percentages of the population act as if it doesn't exist.
That
is like, how much does it take for that to happen? I wonder. Like how many percentage of the people not just not addressing any concerns for it to like fuck everything up?
I am not a expert on politics, although I follow them as closely as anyone else. But I think you can draw a pretty good graph of correlation between rejecting expert advice and support for leaders who themselves reject expert advice. And I would say that the President of the United States, the President of Brazil, these are leaders that have acted in a fashion, and they have made public statements that erode public confidence and understanding of the science behind control measures. And I think you're seeing that. I think there's a portion of any population that are they're going to take things on authority to a greater degree. And if that authority is telling them you don't need to wear a mask, you don't need to avoid public places, you don't need to worry about this infection, it's no worse than the seasonal flu, et cetera, they're going to take that on faith because they don't have the tools to be able to wade their way through that kind of stew of partial and incomplete and hotly argued over information that I kind of referenced earlier.
Yeah, there's I saw a meme going around that was pointing out that the countries with basically the worst responses or the biggest amounts of infections have been America, Russia, Brazil. They've all got strong guy leaders who deny the science, and they're all the ones who are paying the price for that in just big infection waves. There we go, 98. And how many masks are we at now, Rob? 5?
4, just 4. So maybe we don't have enough masks yet. I must be doing this wrong. I must be, I mean, Facebook is pretty clear that, there's a 40 to 60% reduction in oxygen when you are, and Facebook is very, very saying this with great confidence. So, all right, let's add another mask and see what happens.
Mine has cat donuts.
Cat donuts. Donut cat?
Donut. Here we go. Now, these are the masks that have little elastic tie and they kind of start to pull my ears. So that's why I've saved these ones for last,
Yeah.
because they're kind of painful to wear. But
If you know somebody
you
who's
know,
got a 3D printer, these little babies that have no particular name will save your ears.
I thought they were called ear savers.
That actually is a great name for them. They're really, they can actually use them. Hmm?
I've heard that name, ear savers. Yeah.
Yeah,
Am I
because those ear
muffled
loop
now?
masks, you're a little muffled. Yeah.
Damn it! All right, I'm gonna go I'm gonna
What?
reset my microphone sensitivity here.
Wait,
Yeah,
I
set
want to
it
hear.
for 5 masks.
At this point, I want to hear some James Earl Jones.
Luke.
Okay, is this better? Maybe it's not that much better. Can you hear me now?
You're still pretty muffled, but yeah, I can hear
I don't
that.
think the microphone can help with the muffledness.
No, it's not.
Just
Well,
the
what
volume thing
we're
at this
fighting
point.
is Discord's got an automatic noise gate on it, so
Yeah.
it waits for him to get to a certain loudness before it will let him through. You might want to just throw it all the way to the bottom. Well, that way you'll be broadcasting all the time, but it's fine.
Well, here we are, gentlemen. We're using technology against technology
There we
to
go.
stop the Can we stop the oxygen? Is Facebook right? So far,
Hashtag
so
stop
far,
the-
you're letting me down, internet. You're really letting me down. I have not come anywhere close to 60% hypoxia. I haven't actually even achieved 1% hypoxia.
Yeah,
Not even one.
Not even.
Internet.
Yeah, it hasn't even dropped one.
I can't even get it. You know, it kissed 97 briefly, but then just bumped right back up to 98, and I'm thoroughly disappointed. But you know, it's possible. Oxygen might be a much larger molecule than we thought. It might not like to penetrate the woven mask mesh. And we'll get there. I'm convinced we're going to get there. Although this is starting to feel like a bit of a Super Dave Osborne stunt for all you kids from the 80s.
We'll have to cut to a dummy of you being crushed by your mask.
This head.
Well, I think that we're getting into a range of masks now where we're measuring it in like pounds is not entirely irrelevant now. You know, a few more of these, I might start to feel. After several hours, I might start to feel some neck pain. Might have trouble holding my head up. But unfortunately, I still appear to be getting as much oxygen as ever, which is a great disappointment. Although, you know, sadly, it simply just establishes standard physiology and the received wisdom of all these supposed authorities. Which it's just
Now you're rambling, and I'm worrying about your oxygen levels now. Maybe that sensor's no good. Maybe this is the effect we get.
I think the sensor's pretty good. You know, the reason I have this thing is I use it when I go flying, and when you fly near 10,000 feet, there's quite a bit less oxygen and a little bit less pressure to drive oxygen into your blood,
right?
Even when you inhale. So you've got to measure that to make sure that you're not getting hypoxic, because often when you get into early hypoxia, you don't feel any different, even though you're behaving. You might be behaving quite
much like drunkenness. I'm fine.
Much like drunkenness.
You mean you didn't buy that gauge specifically for this show?
I didn't know, but
now I'm disappointed. I was hoping you could be able to write it off or something.
Write it off against all the income that our show generates.
Yeah,
that's right. Yeah,
yeah. The $50 an episode from our primary sponsor, BC Humanist. Thank you.
Oh yes, wonderful.
Yeah, split 3 ways, $16.
Yeah,
but with deep gratitude to our guests. Yeah. So, what are some other things that you're keeping your eye on these days, Greg, that you think that are important to you, that are relevant, that you kind of want to push out into the public sphere?
Well, I've been asked quite a lot lately to give some guest talks about how we open up medical practice and surgeries and other things that were kind of put on the back burner in March. As with many other jurisdictions around the world, in Ontario, there was actually an order from the Ministry of Health to cut out unnecessary visits, to cut out unnecessary surgeries, except in life or limb-threatening emergencies. And now we're at the point where the first wave is definitely in the rearview mirror, and the second wave doesn't appear to be coming anytime soon. We've been looking at, re-expanding what exactly we're doing in terms of being able to see people and provide treatments that perhaps have been on the back burner. There's definitely an issue with people who've been avoiding medical care because of fear of COVID. People still have it in mind that, much like with SARS, being spread in hospitals, which really it never was. They've been avoiding healthcare for that reason. And so we've been trying to come up with packages of ways to try and do things safely. And I think probably one of the neatest ones, without getting too deep into the weeds with in-hospital infection control policy, which is very fascinating, but perhaps not for your audience. We've been looking at ways to try and deliver care without having to be in that 6-foot radius of the patient. And obviously virtual care is all the rage. Various virtual platforms have actually been in use in medicine for at least the last 15 years, and some of them are very similar to what we're doing right now, with different levels of protection. One of the issues, of course, is that in most jurisdictions, there's very, very stringent health information privacy laws that mean that you can't just pop onto Zoom and risk having somebody, Zoom bomb you, listening in as you describe your patient's genital rash to them. That would be inappropriate. Or even something as simple, like even in a secured setting, if we were talking on a secured a virtual interface like this, and we were chatting about some private issue with your healthcare, and your spouse or your children or somebody who should not be hearing it wanders into the room. These are considerations that have been brought into play. So there's been a number of vendors over the years that have tried to come up with secured ways and useful ways of being able to interface virtually. Now, when we wanted to see Rainbow Dash on Dr. Rob's mask there, he had to lean forward close enough for us to be able to get a good look. So you can imagine if there was something like a rash on somebody's arm and you wanted to have a good look on a webcam like this, it's not necessarily that easy to do.
Mhm.
So sometimes there has to be secondary ways of getting information like that. And you can't just email it, because again, it's a privacy issue. Most people use free email servers like Gmail or Outlook or what have you, all of whom data mine that email. You'll send a photo of your genital rash to your doctor, and the next thing you know, your Facebook feed is going to be full of ads for, genital rash creams and sexual health clinics. Absolutely an issue if you're trying to protect your privacy. So coming up with secured ways of being able to get information back and forth has been ongoing for over a decade now, but it's caught on like wildfire. I've got 80 and 90-year-old patients who I'm seeing in virtual meets now, who are navigating through what we last year would have very arrogantly said would have been incomprehensible to them, this idea of, video conferencing for medical care. And it's the need has revolutionized the way we're delivering care. I work in a group practice with a number of other infectious disease docs that are hospital based, and we've got one particular clinic that it runs something in the area of 200 patients a week, which is not big by some specialty standards, but by ID standards, that's a lot of patients. We have managed to get 3/4 of our patients into a virtual care model where we're seeing them either virtually or right now we're also phoning them. That's a temporary measure. And we've actually reduced the number of people physically coming into the hospital to see us. And that kind of thing is spreading far and wide. Docs who last year would have said, there's no way I can assess a patient on the computer, are now doing it. And they're finding that they're actually able to get the information they need to be able to help patients with their issues in a virtual setting. So I always say crises like this are major causes of social change. And this is one of those positive social changes that was a long time coming. And I think we probably advanced 5-10 years our use of virtual care because of this. So there's sometimes good news out of stuff like this.
Nobody can. Joe. Oh, Joe. No, nobody can hear you. The chat is erupting with.
Sorry. You're right, I totally muted myself. Everybody in Discord could hear me, but I had muted myself on this. I'm sorry. So what I was talking about, I'll very briefly catch everybody up here, was saying that this has also pushed my friends past that resistance, that they're getting in onto Discord and starting to do actual like chats like this. Even though many of them were technical, they just resisted joining Discord. They're like, I don't want to have another account. That was the thing I kept hearing. And now that they're pushing themselves past that, they're like loving Discord. They're loving being able to get together, and we're doing like a weekly movie night is what I was describing to these guys. Is that like we get together, one of us streams a movie on Discord, and everybody else watches it. We hang out afterwards and talk. It's real cool. Somebody's knocking at my door. I think that's my neighbor. I will let everybody else keep going, and I'm gonna go check my door.
It's your neighbor just coming over to tell you you're
myself
muted.
Again in case I gotta talk to them.
All right. Okay, so we got mask number 5 on. It's like 10 to 8, you know. Let's see how we're doing. Let's see.
What does that number say? 97.
Oh, there it
97.
is. Drop for 98. You're in trouble now, Dr. Rob.
97,
Wow.
87.
Well, that one. This little number is my heart rate, but the big number is my oxygen saturation.
Oh, okay.
Yeah. We are down. We have achieved it. We've achieved. Look at this. Oh, there's 98. Ah, damn it. Yeah.
It was a 97
98.
for a second.
I'm sorry.
It was at 90. Yeah, solidly 97 for a good 10 seconds. But I'm afraid we're back. Oh. Okay.
So we could argue
Well,
that you've maybe lost a 0.5% because it keeps wobbling back and forth here.
Well, there's natural variability in oxygen saturation, right?
Yeah.
So it depends on local oxygen demand, efficiency across the lungs, blah, blah, blah. How much am I talking? How much am I breathing?
Mm-hmm.
So this kind of bouncing around is completely within normal limits. But let's say that, you know, let's assume the worst case scenario and that 5 face masks has reduced my oxygen saturation 1%. From an A+ to an A+.
And you said that 92 or above is fine. So we've
92 and above is normal, yeah.
So we would have to reduce it a total of say 7 from 98. So that's 35 masks. Is if that's true.
If this ratio holds.
35 masks.
Yeah.
I've got time.
Yeah, let's do it. Have you got 35 masks? Just get Marilee to shove a pillow in your face.
We could just rush out and buy napkins.
Starting to grow a beak. You look like Toucan Sam.
Yeah.
If I get many more masks, maybe I'll start to see Toucan Sam flying around the room. Or maybe I'll be Toucan Sam flying around the room.
I love it.
Yeah.
This is our professional forebears would have had Toucan Sam-like mask back during the plagues of the 17th century, usually stuffed with herbs and the like. I'm actually very disappointed that I wasn't issued one of those at the start of the pandemic.
Yeah.
But,
Yeah.
The Plague Doctor mask, the surprisingly weird and surprisingly effective Plague Doctor mask. Like I can imagine that the beak literally keeps people at a reasonable social distance. They can't get like it's a mask, but also it's got to stay away on it, right? Like,
and it catches a lot of droplets, right?
Yep.
Okay,
Yeah,
so
yeah.
here comes mask number 6. Mask number 6.
Oh my god.
all right.
Okay. Now my ears are pulled forward to the point where I don't know if I actually have. I don't know if I can hold any more masks on.
Are you at max?
Yeah.
Are you at mask capacity?
I might. Oh.
Mask
okay.
capacity, yeah.
That's terrible.
I'm gonna yank on my ears to just. Try
Yeah,
and
we
get
need to get you an ear saver. Who do we know who has a 3D printer in town?
Well, probably not going to get one in the next 5 minutes.
No.
Amazon
A jumbo
bought that
paperclip
fast.
will also do. I can tell you from personal experience.
a jumbo paperclip. Yeah.
Well, too late for tonight. Too late.
Maybe a chip clip.
I
That
was
would do
born
it.
in a dock, shaped by it, molded by it. You may adopt the dock.
Uh,
I can't say for sure. This is more of a subjective observation. It's pretty goddamn hot in here.
Right. Yeah. Yeah. How's your breath? What did you have for lunch or dinner?
Well,
Something vegan, I
I'd
expect.
like vegan, yeah, but unfortunately it was vegan pierogies and
Onions
sausage
and
and
yeah.
other many garlic
Yep.
laden things.
Yeah,
that
you
is
learn pretty quickly that hummus is a bad idea when you're working a long shift.
I haven't had a lot of experience with my mask, but absolutely have been, smelling what I've eaten in it and been like, it's time to pick up some breath mints for yourself, Joe. Yeah. Okay. Should we do? Torn, have you got a penguin story? Because I have one if you don't.
I've got a penguin story.
All right. Is there
bring
anything
it,
before we do
yeah.
penguins? Does anybody want to?
Yeah, was there anything? Did we kind of hit everything that you wanted to address tonight, Greg?
I think so. I want to address one last little bit of viral badness that
Okay.
was circulating in the last week about masks. There was a completely apocryphal story about a young lady who developed pneumonia from wearing a mask. I think you actually referenced it when you talked about, some doctor opining on the internet that a mask was going to drop her oxygen by 40%. But in addition, apparently it was going to have her breathing in her own bacteria, and she therefore got a pneumonia from that. That is so unarguably balderdash. It's almost impossible to really address that because it's completely bonkers. You cannot get sick
Before
from
I
breathing.
started.
What?
Why didn't you tell me this before I started?
Well, I was actually kind of curious.
So sorry, you can't get sick from your.
Breathing in the germs that already live in your airway.
Right.
You
yeah.
can get sick from breathing in the germs that live in your stomach and your gut. That's actually a major reason why people do get pneumonia when they're admitted to hospital for a variety of reasons. They'll vomit and they'll have small amounts of it getting into their lungs. But breathing in your own breath is
Okay.
not going to give you an infection. That is literally impossible.
That makes sense to me, but I'm glad it's confirmed. Yeah.
It's one of those things that came out and it was just so puzzling that anyone would even have that kind of nonsense. Most ID doctors looked at that and said, I'm just not even going to engage with that one. But
Yeah.
I felt I had to step up and engage. If Rob can put his life on the line, I can put my professional credibility on the line for that one.
So brave.
Right.
I salute you.
Where we will go, where science refuses to go. For you.
That sounds like a conspiracy theory website. So I'll put this link in the chat here, and let's see if I can share my screen.
I believe in you.
Share it.
There
So
we go.
live. This is the National Aquarium of New Zealand. This is I've got a more interesting story after this, but I just wanted to mention that for $150 150 New Zealand dollars, you and up to 4 virtual guests can log in to the National Aquarium New Zealand and have a 15 to 20 minute virtual penguin encounter. Visit some burrows, have a chat with one of the penguin keepers, maybe have a chat with a penguin if you speak penguin, and from your computer or your phone. So that's something interesting.
Mm-hmm.
The penguins,
It's $130 Canadian.
There you go. I'm sure it supports the aquarium in these dark days of need. But my other story is this one here. Penguin colony in Antarctica react to this opera singer. I'll include this link in the chat as well because here we go. And I guess you won't be able to hear the sound through my microphone, but it's the visual.
It should play through you sharing, I think.
Okay. Opera singer Nick Allen belts an impromptu song to this penguin colony in Antarctica. Let's play and watch and see what happens.
See, is the video muted on your? Oh yeah, here we go. It's not coming
Yes.
through. Oh, it is muted there.
Or I'll
Oh.
start over.
No, can't hear him.
Oh.
Oh well. They seem to be looking around and wondering what they're running away. They're running away.
Yes. Yeah,
Oh, penguins feel the same as I do about opera.
All right, well,
so there's that.
Fantastic.
final test, final saturation tech. Here we go. Come on, lucky 7.
96, 96, 96.
Sorry,
No,
so
it's
sorry.
97.
Coming up. There it is.
It's 97. Yeah, it
Oh,
looks,
there's 98.
looks like the claims
98.
that masks reduce your oxygen are
99? 99?
bullshit. It looks like a
This is a
98
complete
to.
failure.
It looks like a 98 to. Oh, there's a 99. Okay,
Oh my
yeah.
God.
Wow.
The great one.
Unbelievable.
So
What
this.
a catastrophic.
So it seems
failure.
like is this the
Myth
sixth
busted?
mask? The sixth mask makes there be more oxygen if we're using bad logic here. 5
Yeah.
masks slightly lower, 6 masks back up higher.
Let's not turn this into an internet meme, though. Please don't wear 5 masks. Don't wear 6 masks. Just wear 1.
I mean, yeah, you just need the one.
Especially in situations where you can't maintain distancing. We want you wearing
maybe-
masks indoors, when you're shopping, on the bus, in a cab.
I also wear 3 masks, 2 on my hands. For extra safety.
I have a mask over my heart, but I've been wearing that for much longer than COVID-19 has been around.
Well, there you saw it, folks. We hit a peak oxygen saturation of 99% with 6 masks.
Yeah. So we could get to 100 if you wear 12.
I think so.
I think that's
think so.
what we're going to have to do.
But we might test the audience's patience beyond
I
a
think
reasonable
so.
limit at that point.
Okay.
Well, it's been real.
It
It's
has
fun.
been real. Thank you, everybody, for coming to watch Viral Transmissions, our Maskpocalypse episode. Thanks so much to Dr. Greg Rose for joining us again. Thank you, Dr. Rob Tarzwell, for endangering your life by
we
wearing
didn't know how it was going to turn out.
we did.
Science.
We knew. We totally
Science.
knew.
Science.
Thanks, Torn, for
Science.
making it back and for having the penguin. I'm Joe Foljam. That's Torn Atkinson. That's Dr. Rob Tarzwell. That's Dr. Greg Rose. We're Viral Transmissions. You can find us at viraltransmissions.com. We've got the website there. We've got a YouTube channel. These things are up on podcasts if you want to listen to the audio, which will be fun when I'm muted. And please tell your friends. Spread the word about Viral Transmissions, not the virus. And we will see you all next week, Sunday, 7 p.m. with the Healthcare Cheer. We're out. Thanks very much. We're showing off Rob's face to see the effect of. It's fine. You're fine, Rob. That was nothing.
Okay.
A whole hour. Okay. We're out again.
Whew.